My name's Yareri. Today I will be demonstrating how to perform an arterial blood gas. Indications for this procedure are to assess oxygen levels, assess the patient's acid-base balance, assess how well the patient is ventilating, and assess their response to therapy. Before entering the patient's room, I'm going to review the patient's chart. I am looking for the doctor's order, the patient's medical history, allergens, any medications that the patient is on, especially anticoagulants or blood thinners. I'm looking for a negative Allen's test. If the patient has any skin grafts, shunts, a do not take blood from this arm sign, or blood pressure. I also want to make sure that I check if the patient is on oxygen therapy, what FiO2 they're on, how long they've been on it. If they are on oxygen, you want them to be on oxygen for at least 30 minutes and that they are stable. Before I enter the patient's room, I also want to gather my equipment. I'm going to need gloves and my ABG kit and a towel. And the towel is to place under the patient's wrist to hyperextend their arm. The ABG kit consists of a biohazard bag, a syringe with heparin. The heparin's there to prevent the blood from coagulating. You also want to make sure that you draw the syringe back 1 ml. Your sample size may vary if a nurse or the doctor needed additional blood to sample, arterial blood to sample, or if you had too little, then you can still go ahead and sample that size. You're going to need a Band-Aid, gauze, a bubble cap for your syringe, a safety cap, your iodine pad, your alcohol pad, and 2 requisition slips. I will be filling these out prior to beginning the procedure. The requisition slip consists of the patient's name, patient temperature, room number, test, ventilation, time, and date. So I am ready to enter the patient's room. I'm going to disinfect my hands with 1 ml of hand sanitizer, rub it in for at least 15 seconds. I'm going to introduce myself to the patient. My name is Yareri. I'm a respiratory student at Hartnell College. Can I go ahead and get your name and date of birth? I'm also going to verify that with the patient's wrist. I'm going to explain the procedure to the patient. So I'm here to do an arterial blood gas, and we are going to be drawing blood from your artery, and this is just to assess your blood gas levels. I also want to explain to the patient that there are risks to this procedure. So there is a risk for infection, it is painful, and there is excessive bleeding. So once I've done all that, I'm going to perform my Allen's test. So you do this by finding your the patient's radial and the ulnar. You're going to occlude both, have the patient pump their hand until the hand turns white. So once it has turned white, you're going to release the ulnar, and you're checking for blood flow back into their hand. This should be about 5 to 10 seconds. There is a modified way to performing the test. This is if the patient is unconscious or unable to pump their hand. You do this by, again, finding the radial, ulnar, occluding both, and you would just rub the patient's hand until it turned white, and then releasing the ulnar and then watching for blood flow. So in this case, my patient had a positive Allen's test. I am going to be using the radial artery, and I'm going to be going in at a 30 to 45 degree angle. If the patient's test was negative, I would be using the brachial, and this would be at a 60 degree angle. You can also do a femoral, and that would be at a 90 degree angle. Okay, so then again, I'm going to grab my towel, place it under the patient's wrist to hyperextend it. Okay, and then now I'm going to find my site. You do this by searching for the arterial pulse, and you do this by running your finger up and down the arm to where you find where the pulse is the strongest. So once you have found a strong pulse, you're going to move your fingers side to side to see how big of an artery you're working with. Okay, so now I'm going to clean the site, and I'm going to grab my iodine pad, and then you're going to clean it by placing the iodine pad on the site, and then you're going to be moving in a circular motion outwards to about an inch. And you go outwards to prevent any bacteria from getting onto the site. Now I'm going to do the same with my alcohol pad. And then so center circular motion outwards for about an inch. You can also ask the patient if it's okay to place a Band-Aid and gauze on their forearm. Okay. Okay, so the needle is a little stuck to the cap. And then again, you just want to make sure that the needle's at 1 ml. And then when you go in, the bevel should be facing upwards. And you always want to make sure during the procedure that the patient's okay. So I'm going in at my 30 to 45 degree angle. Okay, once you see that flash of red, you're just going to want to hold your hand still. Make sure your patient's okay because this is painful for them. Okay. Then I'm going to safety cap my needle. And then bubble cap it. And then you're going to tap to release any bubbles. You don't want any bubbles because if you have bubbles, it can cause O2 levels to decrease and CO2 levels to increase. You can also push back or push upwards to get rid of more bubbles. And then you're going to do your figure 8. This is to mix the heparin with the blood, again to reduce any coagulation. You never want to directly touch the blood because that can warm it up. And then you also want to hold onto the patient's site till the blood has completely stopped. This can take anywhere from 5 minutes. If the patient is on any blood thinners, then that can take up to 10 minutes. You never want to leave the patient's room. You always want to make sure that it has completely stopped bleeding. So the patient's blood has stopped bleeding, and then you can go ahead and place the Band-Aid on their site just for comfort. So now that I have my sample, I'm going to label it with one of my requisition slips and then place it in my biohazard bag. And then I will be putting another slip on my biohazard bag. Make sure that your patient's okay, and then I will be running this over to get tested. Again, if you're not able to get it tested within the 15 minutes of performing the procedure, you can put the test into an ice bath. It can remain in the ice bath for about an hour. But after the hour, you would have to perform the procedure all over again. After I received my results, I would make any modifications that the patient needed. There are 3 other ways to performing the procedure. That is through capnography, a pulse oximeter, or a transcutaneous blood gas. And so now that I am done, I have ran my, I'm going to remove my gloves. I'm going to wash my hands. And I am going to dispose of my sharps in my sharps container. I'm going to clean my area, make sure that my patient's okay before I leave the room. And then, so in this situation, I was able to get my sample in one try. If you were performing the procedure and you weren't able to draw the blood within that first try, you do have one redirect. But when you perform your redirect, you want to make sure that you don't completely pull out the needle, because then that counts as one attempt. You have 2 attempts. After your second attempt, you would have to call another RT to perform the procedure. Okay, and that is it. Thank you.